Living Well Youth Services focuses on the development and delivery of innovative health services for young people. While services are aimed at young people of all genders, the uptake by young men is not as strong. At present, only about 20% of our participants from Kensington and Chelsea are male. Our experience and wider experience across the sector demonstrates that young men are often more difficult to engage in sexual health services.
The InForm project was born out of a wish to try and understand what prevents young men from accessing sexual health services in the borough and what could be done to reverse this. This short video documents the lessons learned when talking to young men and professionals working with youth.
We spoke to young men about the barriers in accessing and using sexual health services. Here are a number of reasons.
The barrier that I faced when I first went into a clinic was being nervous, having to talk openly to a stranger about maybe sex advice and just the general going into the clinic, what people may think of me.
The reason why I have not attended is, I think it's because of me not wanting to go by myself.
It is somewhat for the guys a stigma of if I go to the clinic I'm probably got something or I'm that sort of person or I'm deemed as a particular individual that's doing stuff that they shouldn't be.
I just feel that people don't really like that kind of thing because it's awkward.
Some of the barriers I think that young men face is what their peers think of them. I think for them it's their image. I think they're trying to tarnish basically by going to these services.
And there's also pride as well, because the young man might not want to roll into a place and say, sit down and learn about sex, because he might feel he knows what he wants already.
Young guys don't really want to be seen going into the building that says, I've got problems. There's a whole thing about being a loser. By needing help, you've made a mistake or it's your fault.
Time is a big issue because, like me, myself, I'm really busy, like with coursework, I work part-time as well.
Some people, they just rather just try and pretend that it's not there, or whatever, because they're just scared.
Organisations that work with young men provide some insight into what does and doesn't work.
You can't just one approach fits all really. You've got to think, right, who am I working with? Try something, doesn't work, try again in a different approach. I think lots of people try one thing, oh, it doesn't work, they're not interested. But all it means is you haven't maybe found the right way to connect with that young person or that group.
I think a lot of the time we're doing the same things and expecting different results, and I think it's just not the way. I think one of the things we need to kind of focus on is relationship education. We have sex relationship education. I think it should be relationship sex education. That's the issue here. I think young people in general need to understand that you can have relationships with someone without sex being involved. You can have friendships without sex being involved. Right now, we have such a high teen pregnancy rate, and I think that how things like that could be addressed if we speak to young people about relationships. Instead of us teaching young people about the mechanics of sex, how to have safe sex, and when to have sex or stuff like that, I think if we teach young people about relationships, all right, then we're more likely to have less of the issues that we have.
I think there probably needs to be a bigger push with regards to outreach, actually having people, hands-on workers that have got somewhat youth work ethos that are able to kind of engage with and kind of get the banter going with them and get the jokes up, so they see that you're actually trying to give them good information and get them involved in something positively without them feeling like it's a teacher or somebody trying to get them to do something they don't want to do.
I'd say like another good one is getting parents in that have teenagers to learn about sexual relationship as well, because then they can learn a lot and their kids will go home and ask questions. They would know the right advice to give instead of saying, I don't know.
Young people are reluctant to travel. Adults will sometimes go for a course if it's going to suit their learning needs, whereas young people don't quite know what they're letting themselves in for. And the young people attended the sessions because they want to learn about them. Maybe they don't want to do it in school. Maybe the environment in school is not quite conducive to learning. But we tend to find that they want to learn it because it's delivered here, they'll attend.
It's all about trying to make the services that are there confidential, anonymous, kind of branded well, so it doesn't kind of seem obvious that they're not walking into a building that says, you know, here is a sexual health issue, here is, you know, a mental health issue.
They can see that I'm interested in what they are actually saying, so it just resonates with them to say, do you know what, this is somebody I can talk to. And that relationship, again, building the rapport, leads you to be able to get them to come back to you time after time. And when they are in problems and issues do arise, they do actually come to you because you see them as a safe person to speak to.
What we have found is that what young men view as a barrier to accessing sexual health services is sometimes very different from professionals. Because of this, We stress the importance of involving young men in the process of developing programs designed for them. It is even more important to involve young men in developing ways to better meet their needs. We found that young men are often very insightful and willing to work towards ways to better engage them in services they see as accessible and appropriate.
It won't make me want to attend the workshops if more activities were expressed and more interactiveness with other people.
Peer-to-peer teaching, I think that's a great way to spread knowledge for young people, because most people will go to their peers for knowledge, and if someone hasn't got the right information, they're going to feed the wrong information on, and then it gets passed down, and then you're just living on wrong information and you don't know what to do. And then when you do get told the correct information, it's like, what one do I listen to?
I think it would be like beneficial for like the male side to like gain more information more towards like our side and why we have certain feelings at certain times.
I think they should have education on like pregnancy and all different things, not just like wear a condom and this will happen, and because they just leave it too black and white. There's a lot of things and like attachments you can grow for people by sleeping with them. Like it's like you're given a part of yourself when you sleep with someone, so they don't teach you that in school though.
When there's another program taking place that attracts young people, you can just take, let's say, like half an hour from that program to get some of the young people. Because initially you're not going to find a lot of people coming for this station.
Free food. I swear that'll make better people come.
Don't be judgmental to them, because with boys, they struggle harder to like cope with like patronisation and stuff like that than say females do. So just don't be judgmental. Let them have their freedom of speech and just tell them what they need to know. Innit?
The InForm project has given us an insight into what has and hasn't worked in the past for both professionals and young men. The key to moving forward is putting what works into practice, continuing to adapt our approach and engaging young men as needs evolve. Young men represent a very important group to engage in sexual health services, and we at Living Well continue to strive towards identifying and addressing the needs of this group.